Hi, this is Ganesh Kumar Jimee from National Society for Earthquake Technology Nepal, working as Director for Disaster Preparedness and Emergency Response Division. I will be presenting about the emergency response activities done for April 25, 2015 Nepal Gorkha earthquake and its aftershocks. Among the EERI's other activities, other presentations, this is for the emergency response. It is highlighted here with red text. I will start with the experiences from the local people in the affected areas. In terms of day and time of earthquake, they have different feeling, like it was daytime and Saturday, so that students especially were out of the buildings and offices were closed, and because of the daytime all the people were outside the building in the field, so the earthquake could not make more casualties. If it was nighttime, the scenario could have been different. So they were lucky in that case, they were feeling. And also the duration of the earthquake, it was very interesting that they shared with us that the shaking was more than 10 minutes, but it was not in fact. But and the shaking type was up and down and left and right, all types of shaking. They realized that. So about the aftershocks also, actually in the Dolkha and Sindhupalchok districts, most of the buildings were collapsed during the aftershock because those were heavily damaged due to main shocks and they were collapsed. But during the main shocks, the people were out of the building and they abandoned the building and didn't go in again. So the aftershock didn't kill many people. So in that case also they were feeling that they were lucky. And still the people were feeling aftershocks, and they were feeling that they were sharing that the earthquake has not stopped anytime. It is still shaking. So that was kind of psychological effect. And about the safe behaviors of the during the earthquake, they have learned from the TVs, radios, and many media sources, and also from the schools and school children. And but the problem is they could not interpret the safe behaviors and could not implement in the different cases. So, how they responded individually, we asked in the affected areas that they worldwide accepted this drop, cover, and hold on. We asked about this also, and there were a mixed type of responses. That drop, cover, and hold was very good in some cases, and they could survive, save their lives. But in some cases, they were trapped inside the buildings and doing drop, cover, and hold. And sometimes what happened, that the people who were outside and went inside the building again and performed drop, cover, and hold and were killed. So they had different mixed type of responses. And responding each other, helping each other during this earthquake was very interesting and very happy to know that people, though they didn't have skills and equipment, but they could help each other. They were the first responders in the community people. And also the safe and unsafe areas. Regarding these areas, the people were confused. Okay, after earthquake, they exit the building. They came out from the building, but they didn't know where to go after that because they didn't know where is safe and unsafe areas. But they have realized that some of the narrow areas supported from all sides were safer than other areas, like bathrooms and small stores, something like that. But some were found dead in those areas. So that was also another learning. So this is the current emergency response system of the country. Like if there is a disaster, then immediately the chief district officer, who is the lead of the DDRC, that is District Disaster Relief Committee, gets information and reports to NEOC, National Emergency Operations Center, in Ministry of Home Affairs. But he can report through regional district disaster relief committee as well. And based on that, the central natural disaster relief committee meeting will be called in the Ministry of Home Affairs. Then based on those recommendations, in the meeting outputs, the government will analyze and declares the disaster and emergency in terms of time and area. And if it is required, then they will decide to appeal to the international communities through UN resident humanitarian coordinator. Then UN resident humanitarian coordinator will coordinate the international communities, but they will be in touch with the government as well. Next. So the initiatives before earthquake for the earthquake response, emergency response, are some of the examples. Like national strategy for disaster risk management was approved, and the National Emergency Operations Center is functional, and National Disaster Response Framework was improved and implemented, and all 75 districts have this disaster preparedness and response plan. 83 open spaces, at least in Kathmandu Valley, were identified, and other 887 small areas also identified. And Earthquake Safety Day is observed in Nepal each year, and there are many other training programs for the emergency capacity enhancement, and the building code is one another pioneer activity that is implemented in Nepal. But still, during this earthquake, there are many realizations and the lessons learned that those activities and the documents should be updated and reviewed and implemented strictly. And regarding the training programs, they should be scaled out. So regarding the response for this earthquake, as usual in other countries, in other earthquakes also, the immediate spontaneous response was from the community, and large number of community people were in the response, but they didn't have skills and equipment, but they could do the mutual help. And the national teams, professional teams, especially from the Nepal Police and Nepal Armed Police Force and Nepal Army, were there in the scene, and they could save many lives. And definitely from the other countries. Actually, there were more than 4,000 responders, search and rescuers from other countries, with 135 dogs. While talking about the response, then the effectiveness of this rescue and recovered victims is very interesting to analyze. Like out of total 9,256 dead bodies and 22,326 injuries. Most of the injuries and deaths were extricated and recovered by the community people and the victims themselves. And some of them were extricated and recovered by the national teams. But there was a large number of international search and rescue operators, squads, but unfortunately, they could save only 19 live victims in this earthquake, and 135 dead bodies were recovered by the international teams. It is based on the report from the Nepalese Army as of June 16. And arrival of the international teams is also another interesting point and very important to analyze. Like Nepal is the landlocked country, and it is almost impossible to arrive here immediately after the major earthquake. If you see in this earthquake also, most of the international teams arrive in day 4, but it is already late for saving lives, the victims, and they could save very few lives actually. And some, the India nearest one, arrived in the day 1, but others even in day 6 the responders were arriving. So the arrival time and that will actually result the success of the extricating and recovering the victims. The shelter, actually the shelter immediately after earthquake, it was very haphazard, and people, the affected people sheltered nearby the damaged houses, though there were identified open spaces, but very few of them went there, and there were very few formal shelters. And the government announced the wonder policy, but it was not effective for the distribution of the relief and shelter kits. And it provided initially 15,000 Nepalese rupees per family. The distribution mechanism of the government and the other agencies was quite compliant by the affected people. Like they preferred distribution of the materials considering the family members, not by the houses, and also they prefer to be distributed by the ward offices. Next. Food was another problem, immediate problem, because the food was trapped or under the debris of the damaged and collapsed buildings, and they could not went there to bring out the food because of the aftershock, fear of the aftershock. So the shops were closed and food was not available, and that was a great problem, big problem, and especially in the villages, remote villages, it was very difficult to deliver the food also, because roads were also damaged and very far the vehicles could not move, and only the helicopters. And actually this time the need of earthquake go back and household kit was realized, because the food, emergency food in go back and household kit was used in some families, by some families, so other families in the community also realized. So the medical response, it was also immediately after earthquake, it was a big problem, but fortunately the major hospitals were not was significantly damaged and collapsed, so most of the hospitals could operate at least in their premises. So, and also the government announced the arrangement, free treatment arrangement for the victims. And there were many international teams in the affected area mobilized by the Health Emergency Operations Center of the Ministry of Health. The land transportation was heavily affected, especially in the Dolakha, Sindoli, and Dhading districts. The roads were blocked and collapsed, damaged, and still we could see the vehicles were trapped. Many people were killed. But road opening from the two sides, from China sides and from the Nepal sides also, with the involvement of the Chinese rescue teams and also from the Nepalese security forces was going on. The airport, basically airport was okay. Out of 51 airports in Nepal, none of them were significantly affected. The TIA, Tribhuvan International Airport, was functional, but for a short time they closed, but it was normally operated after 2 weeks. And actually they have this emergency response plan, and they have system to operate that and test that. And actually during this earthquake, more than 1,800 rescue flights operated by this Tribhuvan International Airport, and they made the arrangement of supporting and assisting the international humanitarian teams for 24 hours. The information management and dissemination was another component or another field during this emergency, during the earthquake emergency. Actually, the government established a public call center to receive and to disseminate the information, and most of the media sources, telephones were okay, and they were operating. And very interestingly, though very less in number. The ham operators also could communicate and report regarding the earthquake, and social medias were very effective during this earthquake, and spatial information was also provided by different groups and individuals. For the on-site mapping and imaging was done by the drones also. But we realized actually this time the national lack of national policy in terms of information and media, like drones. There were many drones, but after some days they were restricted because of the sensitivity of the security and in the heritage areas. Some of the recommendations and lessons learned are done here, like the community responders. They were the first responders, and their response was very effective. So at least one response team in each village is really needed, with the equipment, minimum equipment, so they can serve, they can help each other till the professional responders arrive at the scene. But the professional responders in the national level also required with the equipment. And definitely the coordination mechanism should be developed, and whatever exists so far, that should be improved, and with the incorporating the lessons learned and recommendation from this earthquake. And there should be common understanding about the plan and policies in all levels. And the national search and rescue teams and community teams should be strong enough, or should be aware to help the international search and rescue teams, to guide the international search and rescue teams in the local context. There are many plans and policies, but they need to revise and update. And there should be one testing mechanism and regular update. And review and standardizing the awareness materials is also realized this time, because of the misunderstanding sometimes, and not disseminated in the wider areas. It was not somehow effective, and sometimes the misunderstanding could misguide them. So this is also very important. And I do have some recommendation for the further research, like safe behavior. Where is safe and unsafe area, and what are the safe and unsafe behaviors? That also should be understood and studied in the context of Nepal, in the context of socio-cultural and environmental aspect and building types of Nepal. And temporal variation of the extricating the live victims also should be studied. And the comparative study of the cost and saving lives also should be studied. And similarly, the induced landslides and their potential risk is also should be studied. So in short, I presented in this presentation, but there are many things in detail. If you want to know, please visit www.eqclearinghouse.org, and you can have there, you can see there the photos, reports, and other detailed information. At the end, I want to acknowledge all the offices, organizations, and individuals who supported this EERI team for the field and for the collecting the information, especially EERI LFE program, NSET, and NSET actually my own organization who nominated me to be a part of EERI team, and other EERI members, field members, my colleagues, and the people from the affected areas who could cooperate with us in such tragic situation. And thank you for my virtual team collaborator, Jennifer Lajo, who uploaded my photos to the EERI map, and also the people like Chief District Officer, Local Development Officer, and Dolkha District, and the Chief Executive Officer of Bhimeshwar Municipality for their cooperation during our field visit. Thank you very much.